Thanks everyone for joining us for this month's Thought Co-op. The title of this talk is Conversations with Tri-County Health. And there's no doubt that this organization has been a presence in our lives for the last couple of years. But I want to applaud Melissa, one of our speakers, for really reaching out. Tri-County has been a long-time member of the chamber, but asking if there was some venue that they could really share a little bit of information, but also gather feedback from our business members. And so that's what we're here really to do today. So with that, let me introduce to you Melissa Seger, Policy and Public Affairs Officer with Tri-County Health. Melissa?
First, David, right back at you. The Chamber has been just a fantastic partner, not only throughout the pandemic, because of course our relationship changed quite a bit when that got started, but well before that. And so a huge shout out to you, your membership, just a fantastic group to work with. And we appreciate you inviting us to this. Like I said earlier, just a good opportunity. You are a strong messenger, the chamber, but also all of the businesses. So loving the opportunity to update all of you. We'll get our contact information into the chat. I'll ask Keith to throw that in there. And then David, you can push that out to any and all folks that may have questions for us. We welcome them. It really helps us direct our work to what the business community needs, and that's really what we're here for. So thank you for having us. The Business Reopening Task Force is what we created during the pandemic, and that's the contact information we'll get into the chat. Of course, like I said, we've worked together before the pandemic, and we work with the business community at large across our jurisdiction. We have lots of shared goals: a healthy workforce, a healthy community, and businesses, employers, a huge component in that, whether it's directly with their employees or directly with the community, because you all are essential. So we appreciate you. I'll start with data, and I'm sharing my screen here. I have a lot of tabs open, but I'm going to walk through these. Just encouraging folks to use Google. It's a good way to find information. Things pop up right away. So you'll see here, I just Googled TCHD COVID data, and our COVID data page pulls up very first. And I already opened it here just so things were loaded up, because sometimes it takes a minute, and it still loads anyway. Wanting to show these, well, first, real quick, I'm going to show you data. I'm going to talk about public health and executive orders. Even since we talked last week, David, there was a big announcement with vaccine requirements, and so I'll go through that quickly. And then I'll touch base on federal requirements that we're seeing, including that Osha vaccine mandate, and then the future of Tri-County, because I know folks have questions. Who am I going to reach out to? And I just want to reassure folks as I close out. So first, data. This is Tri-County's page. These guidance metrics are the metrics that we've used under public health orders. If you'll remember that dial that we used for a very long time, they're color coded, red being not great, down to blue was the color. So you can see here, this is our 7-day cumulative incidence rate per 100,000. This is really the key metric. It's the metric that CDC uses as well, and I'll show you that. You can see all of us are in the red here. I'm going to show you what, oh, never mind. You can see right here. This is what the metrics are under that public health order dial that we had before. 0 to 10 is low transmission, 10 to 49.99 is moderate, 50 to about 100 is substantial, and more than 100 is high. So we're significantly above that now in all 3 of our counties. And of course, we chat through different data pieces, and I'll show you a few others: hospitalizations, positivity, how many people are vaccinated. We get a lot of questions about natural immunity, something that we're still watching very closely. It does not offer the level of protection that vaccine does, and so it's not a key metric that we're looking at when talking about restrictions and really where we are in the pandemic and preventing overwhelming our hospitals. It's really vaccine that gets us there. So here are those metrics. I'm just going to show you 2 more on here, But you can see there are a ton of data points here. Our data team is collecting any and all information that helps the community, policymakers, our elected officials, our local government staff navigate this pandemic and understand really where we are and where the pain points are. So I encourage you to take a look at this. I'll put all of these links in the chat. But the next one I want to look at is incidence rate. It is that metric, that incidence rate that I just showed you, but it's in a bar graph form. So you can see a little bit of where we've been and where we are now. I'll say, and I'm going to show you hospitalizations. You can see we're above this point in the pandemic where we were in last summer. So April, May, we had this spike. You remember restrictions came into place, not as tight of restrictions as we saw back at the beginning of the pandemic, and certainly this spike in the winter, but we saw some of those restrictions come back. Tri-County had a limited COVID restriction dial in place here. And then we're above that now. And so it's a good metric to just show you again where we've been and where we are. But those hospitalizations are key because we have more limited staff now in our hospitals, and we're seeing that reflected in our hospital capacity. Actually, I'm not going to show hospital capacity. You saw that graph just a little bit. I'll go back to it so I can show you. You can see we're bouncing up here again past that spike that we saw in the summer. And then the state is really communicating out about this because our hospital capacity is limited. The last number I heard was fewer than 85 ICU beds across the entire state. And so that's very concerning. The state has implemented crisis levels of care, which means they're putting off some procedures that ordinarily they would not put off. They're transferring patients, no permission needed to accommodate capacity shortages. Our hospitals can transfer patients anywhere across the state. And so those aren't things that we want to see in place, and they are right now. So watching very closely. The numbers are still going up. We don't like to see numbers going up, but it does look like they're going up slower. I will say, and you can see this in the graph here, we thought that cases had started to level off and even go down right here. So you can see that little dip, and they popped right back up. So it just emphasizes the need to keep an eye on this over time. 1 day, 2 days, a week, 2 weeks isn't going to do it as far as what's happening, where are we going with these trends. It really does take some time. And even when we see improvements, we got to keep watching because it can change. And then the hospital capacity, I'll pull this up. I wasn't going to. It's just a little tricky because there are a lot of factors that are very difficult to track, like staffing. And so you see these weird ups and downs here. I'll get a little summary of hospital capacity over to you, David, to push out, just because I know it's confusing for folks. It's hard to understand and changes, but wanting to show that you. And then very last here, vaccinations. This is again, Tri-County specific page. So you'll see Adams, Arapahoe, and Douglas counties on here. Just wanting to show overall vaccination rate. You can see completed boosters, of course, lower as it should be. And then vaccination by age, another key metric that we're looking at. I'm going to move a little quicker. CDC COVID data, again, Google that. Easy to find. It's going to pull up this data tracker. I open that here. I'm looking at county view, your community. Again, lots of data here. Pediatric is a new page, and we're watching closely. We have that data as well. But the county view gives you a good idea. You can see across the country, we're not alone. We did see huge peaks in the south here before COVID, before Colorado was peaking. And we think it has moved through a bit, and that's why we're seeing a drop. We're worried about the holidays. It's cold. People are moving inside. People are gathering very closely, those Thanksgiving and Christmas and Hanukkah gatherings are close gatherings, and we worry about that, especially for our unvaccinated folks. It's probably seeing some natural immunity down here, worried that it may not last very long, especially with the holidays coming. You can see Colorado here still very much in red. And if you click on your county, it'll zoom in. I clicked Douglas, but I'm going to click Arapahoe. Whoops, a little tricky. Arapahoe here. And then I mentioned those incidence rate metrics. So this is what we're looking at for the CDC data, also in high. It's what we're tracking on our page. The biggest thing to note here for CDC data is mask recommendations. The CDC recommends masking in all indoor public places for substantial and high transmission. So we require in schools, CDC recommends in schools all the time. In the general public, strongly recommended for high and substantial. And so if you have a business where you're welcoming the public into your space, good to have folks masked up. Recommendation even on the door, it's recommended that all individuals wear masks. CDC has signage that says, this is under CDC guidance. We have template signage too. Cases are high. We recommend. You can require for all individuals in your business and are encouraged to do so. Okay, so that's data. I'm happy to take questions at the end, but just going to keep moving through this pretty quickly, wanting to pull up those public health orders. So again, Google is my best friend even still. CDPHE, that's our state health department, the Colorado Department of Public Health and Environment orders. It's going to pull that page up very first. We do have, the page shows public health and executive orders. So these are from the governor. Throughout the pandemic, we usually saw the governor issue an executive order directing the state health department to issue a public health order. The CDPHE, as our state health department, does have that authority independently. And we did see them exercise that a bit with these new vaccine mandates. Very quickly on executive orders, I just want to highlight, you'll see a lot of things here. So if you get into this page and have questions, reach out. Hospital reporting, lots of changes in statute to allow certain providers to provide vaccine, certain waivers of reporting requirements. This is urgent. We need folks responding urgently, and we need as many professionals as we can to give vaccine. And so you'll see a lot of that here. With that, in order for the governor to waive statutes like that, there has to be a declared emergency. That's what triggers his authority to issue those orders and waive those statutes. And so we do still have a statewide public health emergency in place across the state of Colorado. We don't talk about it very much because we also have a federal declared emergency in place, which covers a lot of things, primarily for us and our conversation here. Paid leave. Emergency paid leave is still required because there is a statewide and federal emergency declared. And so that public health emergency leave still required. And I was going to click open the most recent order. The governor's orders are a little weird because you have to open all of them to see the whole order. And at this point, we're at 1, 2, 3, 4, 5, 6 different amendments to this order. And so all you're going to see is an extension, maybe a few changes. You have to go back and look at every single one of them to see what's in place in total. See, pretty short, just amendments. And so if you have questions about what's required under the governor's order, reach out, but just know that that public health emergency is still in place. And then public health orders, this is what's issued by our state health department. Vaccine access and data reporting, not so much for our businesses, that's for our providers and hospitals. Limited COVID-19 restrictions is what we're looking at now. And I'll open this order. We saw a few masking requirements stay in place for our businesses, very limited, primarily medical settings. So your doctor's office, the hospital, urgent care, it's all going to be required. for unvaccinated individuals, also homeless shelters, prisons, jails, community corrections. So very limited, but we did see that stay in place for those unvaccinated folks. Same exceptions that have been in place with the state. But the biggest change that we saw come just recently were these vaccine requirements under CDPHE's public health order. So they added this in. It doesn't start until November 19th, which of course is very soon. We're still gathering a lot of information here. This is a statewide order. It gives me an opportunity to say what the Business Reopening Task Force is here for. We're information gatherers and connections to resources. So we don't necessarily make the orders always, although Tri-County does have the authority to do so. We seek out information from the state. So an announcement comes out from the state, an order, a guidance document. We had a public health advisory, and you have questions, we're going to connect with the state. What guidance do you have? Here are the questions coming in for our businesses. We don't get to make a lot of choices about how this is applied. Instead, we go back to the state. How are we applying this? We're required to enforce orders issued by the state under state law, but we need to go back to the state to ask for clarity. And we're asking quite a few questions about this. And so it requires, you can see here, effective November 19th and only till December 31st, all unseated open to the public. So this isn't a private event. It addresses that below. Indoors, so not outdoors, not your Broncos game, of 500 or more individuals. It's in a single room. So that's a big group of people. You get multiple rooms going. It's unseated. It's 12 and older, fully vaccinated to be admitted into that space for that type of event. We have questions. What constitutes an event? How do we distinguish separate spaces? What does seated mean? This is for those unseated events. And so what does seated mean? Is that seated all the time? You all probably remember lots of these discussions from back at the beginning. If you have a buffet style, is that still considered seated? It doesn't apply to restaurants, and so just these events. So we've gotten lots of questions already. We've gotten questions from our event venues, our hotel spaces. How does this apply? What needs to be in place? There's a process for a variance request. You all remember those. We don't know what that process quite looks like. It is going to come from the state, and we're looking to them for that guidance. And so we continue to talk to them. What does that look like for a business to seek and be approved for a variance to this requirement? And so if you have questions about this, reach out. We're taking those directly to the state, bringing them back to conversations like this, our bi-weekly webinar, which we'll also get into the chat for folks and out to the broader business community. So just know that these things come through the state. Still reach out to us. We have those channels of communication and can field those questions and then bring back answers. And so do use us, but just know that a lot of these decisions do come from the state. Very quickly, Osha vaccine requirement, because we are just seeing these trends here for vaccine requirements. Rationale, we know that these work. We know that we've seen it play out across the country already when these vaccine requirements are in place, whether it's for employees through an employer or for the general community to come to restaurants or events, they comply. We see people get vaccinated. We don't see very many people quit their jobs. We don't see very many people stop going to events and restaurants completely. They get vaccinated. Vaccine is the way out of this pandemic. As COVID spreads among unvaccinated, we worry about variants that could not respond to vaccine, that could spread more easily, like we saw with Delta, that could not respond to treatments. And so vaccine is the way out. And these are ways to get folks vaccinated, vaccine mandates. OSHA put out a rule for businesses of more than 100 employees. Your employees have to be vaccinated or tested weekly. We have lots of information on that vaccine requirement and how it's applied. There is a stay in place, which means the court is hearing the rule to determine if it's valid or not. Vaccine requirements have been upheld time after time. Employers can absolutely require vaccine and are encouraged to do so. Businesses can require vaccine for the public to enter, just like shoes and a shirt. Absolutely acceptable, solid. The challenge to the Osha rule is process. Does Osha have the authority to issue this rule? Did they follow proper process to issue this rule? So not so concerned about vaccine mandates. Those are allowable. Like I said, this is more process. Is OSHA the way to go? Are they allowed to do this? And did they follow a proper process for their emergency standard? So more to come. The Sixth Circuit will hear that, and it may go to the Supreme Court. It could move very quickly. And so businesses are strongly encouraged to take a look at that rule. Be prepared if you have over 100 employees. Even if you don't, strongly encouraged, and just referencing this state order. This is minimal, very minimal, but this is the direction that we're going with vaccine mandates. And we see this playing out across the country. And then very quickly, just wanting to highlight some resources. This is the Network for Public Health Law. Lots of fantastic resources here, especially if you're nerdy public health like me, but really great guidance for businesses. So here's guidance for OSHA's vaccine mandate that I just mentioned. Here's vaccine mandates in recent court cases. And so if you're interested across the country, what are the courts saying? What's being implemented? We've seen statewide, citywide requirements, and I'm sure you've seen those play out on the news. And so lots of good updates and resources here for our businesses. The Network for Public Health Law is far from the only organization. Look to your chamber as far as links to guidance documents, announcements when new guidance documents come out. Look to us. Also, human resource agencies, lots of free information out there. Law firms even, lots of free updates and what to know, and guidance when to talk to your own attorney, things like that. And so Google, really great. And then reach out. Something weird, you're not sure, is this a good source? Is there any other information? We'll take a look. Again, the questions that come from this community really direct our work. It allows us to put our time and energy into what you all need. And that's our entire purpose here in COVID. The final update I have is just the future of Tri-County. Lots of news recently, some very disappointing news, as I'm sure you've seen. Douglas County withdrawing from Tri-County. What happened there is they created their own Board of Health and then contracted with Tri-County to continue providing those services for some time as they build out their health department. Adams County just gave a notice. They have to give 1 year notice before leaving that they intend to withdraw as well. We are having lots of conversations. This could look a lot of different ways as far as what Tri-County looks like, what we're called, how we interact still with Douglas and Adams. Again, we're still providing all those services for Douglas. What makes the most sense to share? Are we a health department for folks, which is a very real possibility? Certainly Arapahoe still with us, having lots of conversations. Lots of unknowns. What I can assure you is that you will always have a health department. So keep reaching out to Tri-County. We will very broadly communicate out if any changes are going to occur. Nothing within the next year. It really is going to look quite the same. And then we'll be pushing out information as far as what that will look like as we move into the future. COVID, you will have a point of contact. Again, nothing more immediately, and we'll push out information if anything changes there. So keep reaching out. We're here. You will always have a health department. You'll always have a point of contact, and we'll make sure that folks have that should something change. Nothing more immediately. All right, David, I talked quite a bit. I'm happy to take questions or touch on anything that maybe I missed.
Thanks everybody for joining us. This will be our last program for 2021 as we begin to plan for next year. You can still keep up to date on our business community through Facebook, Instagram, LinkedIn, or on our website at myinglewoodchamber.com. See you next year.